On this edition of Veterans Health Watch, we'll learn about the VA healthcare services offered to veterans diagnosed with breast and colorectal cancer.
We'll also learn how the VA Maryland healthcare system is helping veterans and their family members manage the day-to-day challenges of living with cancer.
Welcome to Veterans Health Watch, a program sponsored by the Veterans Affairs Maryland healthcare system that provides the latest health and benefits information for Maryland's veterans, their family members, and the local community. I'm David Edwards.
And I'm Kenya Griffin. I'm happy to be here for today's show, focusing on the services that the VA provides for veterans facing breast or colorectal cancer.
That's right, Kenya, and we're going to start by talking about breast cancer. And joining us now is Dr. Susan Kesmodel, who is a surgical oncologist with the VA Maryland healthcare system and an assistant professor at the University of Maryland School of Medicine. Dr. Kesmodel, thank you for joining us today.
Thanks for having me.
Well, if we could start by having you tell us exactly what is breast cancer and what causes it.
So breast cancer is a type of cancer that develops in the tissues of the breast. And over time, the cells in the breast can undergo changes, and when enough changes accumulate, that can develop into a cancer. There are multiple factors that can contribute to the development of breast cancer, including genetics and family history, some lifestyle factors, and then also some prior treatment for other medical problems.
So can you tell us a little bit more about genetics, because that's something that we've been hearing a lot about in the news lately, is how genetics impacts somebody's risk of breast cancer.
So while genetics are involved in the development of some breast cancers, it's important to note that only 5 to 10% of breast cancers are related to genetic mutations that we can identify. We do offer genetic counseling and genetic testing for patients. Some of the things that we look for in a patient's family history that might clue us into a genetics abnormality are things like breast cancer in multiple generations on one side of the family, breast and ovarian cancer on one side of the family, or breast cancer in a male family member.
We recently taped a show that introduced the three-dimensional digital mammography and that allows the physician to actually view the breast tissue one layer at a time. With new advances such as this, what are the current recommendations for screening mammographies?
So the recommendations for screening mammography vary depending on what national organization you look at. But at the Baltimore VA, we currently follow the guidelines from the American Cancer Society and the American College of Radiology, which recommend that women start getting screening mammograms at the age of 40 if they're at a general risk for developing breast cancer. Now, in patients who have a family history of breast cancer, especially if that's early onset breast cancer under the age of 50, and if it's in a first-degree relative, then we recommend starting screening 10 years earlier than the earliest diagnosis. So for example, if your mother was diagnosed at the age of 45, then we would recommend that you start screening at the age of 35. For patients with a very strong family history of breast cancer, or who have a known genetic mutation, or who have a family member with a known genetic mutation who have not undergone testing, we can sometimes also use screening MRI for those patients.
Dr. Kesmodel, we all know that when an individual finds a lump in his or her breast that they need to see their physician to have that evaluated. But are there any other things and symptoms that they should be aware of that could cause concern and need to be evaluated?
So typically we'll diagnose a breast cancer either on imaging evaluation or by identifying a palpable lump in the breast. But there are other changes that can occur in the breast that may clue us into a problem that needs to be evaluated. So for example, we can have changes in the skin such as redness or thickening of the skin, dimpling of the skin. Sometimes patients will have nipple discharge or develop a rash around the nipple. So those are other things that might suggest that a patient has a problem.
And what types of tests should a patient expect for you to run to determine if a lump is malignant?
So when a patient identifies a lump, the first thing we recommend is that they see a healthcare professional. That can be a nurse practitioner or a physician. And at the Baltimore VA, we have a women's health clinic. So a lot of patients are initially evaluated in the women's health clinic. If on exam there's something suspicious, we then send them for additional studies, which usually includes a mammogram. And then we usually also obtain an ultrasound, which can just help us to better characterize the mass. And then if it's something that looks suspicious based on the exam and the imaging, then we go ahead and get a biopsy. Once we have a biopsy, if a cancer is diagnosed or maybe there's something suspicious in the breast, then the patients are referred to the breast surgery clinic, which is where I will typically get involved.
And Dr. Kesmadel, what is the difference between the grades and stages of breast cancer?
So the grade of a breast cancer is the changes in the cells that we see under a microscope. And this can include how many of the cells are dividing, whether the cells look uniform or varied, whether the cells are actually developing into structures that look like breast tissue or whether they're developing into structures that don't look like breast tissue. And taking all those things together helps us to define the grade of a tumor. So grade 1 tumors tend to be a little more favorable and less aggressive. Grade 3 tumors tend to be a little worse. So the stages of a breast cancer help us determine how advanced a cancer is. And when we look at patients with cancer, we stage them from stage 1 to stage 4. Stage 1 being the earliest stage, and stage 4 being spread of disease to other areas of the body. So in the case of breast cancer, if we have a small tumor which is localized to the breast, that's considered stage 1. Once the breast cancer moves into the lymph nodes, that's considered stage 2 and 3. And then, of course, if it spreads elsewhere, it's considered stage 4.
And what are some of the surgical options available to manage breast cancer?
So when patients are diagnosed with breast cancer, they really have two surgical options. They can either have a mastectomy, which is where you remove all of the breast tissue, or they can have a lumpectomy, which is where you just remove part of the breast tissue. If a patient is diagnosed with an early stage breast cancer, something that's small and localized to the breast, they're typically a candidate for either approach. Sometimes, of course, we have patients with more advanced tumors, larger tumors, and they require mastectomy. Luckily, our reconstructive options have improved significantly over the last 20 years, so patients who have to have a mastectomy can also have breast reconstruction.
And Dr. Kesmadel, for our veterans in our viewing audience today, where can they go to get more information about breast cancer, what they should look for, symptoms, and treatment options?
So I think that some of the best websites are the American Cancer Society website and also the National Institutes of Health website. And I think it's really important for patients to always discuss their family history and the recommendations for screening with their primary care physician so that we can appropriately get screening in each individual patient.
We're going to go to a break in a very short minute, but is there any last parting bit of information you'd like to leave for our viewing audience?
I'd really just like to emphasize again that screening mammograms and early detection are the most important things in treating breast cancer.
Well, Dr. Kesmadel, thank you so much for joining us today. I really think this was informative for our viewing audience and very timely, so thank you.
Thank you.
We're going to take a break, but when we come back, we'll be talking about colon cancer, so please stay tuned.
A lot of women veterans don't realize that the VA is here to take care of them. They served and they deserve the best health care that there is. The Women Veterans Program has been redesigned to meet the needs of the women veterans.
Female veterans receive just as good a care as men because they're focused more on us now.
We want them to come here, we want them to feel welcomed, and we want them to know that we are capable and willing to take care of them.
The VA Maryland healthcare system
We would like to recognize and thank Maryland veterans.
who fought to protect freedom and democracy.
It makes me extremely proud to be able to serve you at the VA Maryland healthcare system.
From all of us from the VA Maryland Healthcare System, happy Veterans Day.
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 Welcome back to Veterans Health Watch. Joining us now to talk about colorectal cancer is Dr. Eric von Rosenving, the Chief of Gastroenterology for the VA Maryland Healthcare System. Thank you so much for joining us today.
Thank you for having me.
Dr. von Rosenving, I understand that colorectal cancer is actually the second largest killer of cancers in the United States, next to lung cancer. Can you give our viewing audience an overview of really what is colorectal cancer?
Certainly. So colorectal cancer is a cancer of the large intestine. Together, the colon and the rectum make up the large intestine. If left untreated, colorectal cancer can spread to other parts of the body and can cause serious illness and even death. Most colorectal cancers start as a precancerous growth called a polyp, which may turn into cancer over time. The American Cancer Society estimates that about 142,000 Americans will develop colorectal cancer in 2013, and about 50,000 Americans will die from the disease. To put that in perspective, more Americans will die from colorectal cancer this year than died in the entire Vietnam War.
So it's really important for us to know then what are some of the symptoms of colorectal cancer?
Well, first it's important to point out that not everyone with colorectal cancer will have symptoms, especially in the beginning, and that's why screening is so important. When symptoms do develop, they can include bloody bowel movements, abdominal pain, loss of weight, new diarrhea or constipation, or symptoms of anemia. And anemia is low blood counts, and that can have symptoms like excessive fatigue or shortness of breath, especially with physical activity.
And Dr. von Rosenving, who is most at risk of developing colon cancer?
Well, the biggest risk factor for colorectal cancer is age, and that's why we recommend that veterans and others over the age of 50 get regular screening. Other risk factors can include having a family history of colorectal cancer or a personal or family history of colorectal polyps. And some studies have shown that diets high in red meat or diets low in fruits and vegetables, obesity, lack of exercise, excessive alcohol, and smoking can all also increase risk.
So far you've emphasized the need for screenings and the importance for screening. So how is colorectal cancer diagnosed?
So usually colorectal cancer is diagnosed with a colonoscopy. And what that is a test that involves a long flexible tube about as big around as my little finger with a light and camera at the end, and it's passed through the large intestine, and biopsies can be obtained, and precancerous polyps can be removed. Sometimes colorectal cancer is also diagnosed with X-ray tests, such as CAT scans, or with surgery. Ideally, colorectal cancer is diagnosed before symptoms develop because that's when we have the best chance for a cure. In fact, if you diagnose a colorectal cancer with a screening test before symptoms develop, then over 90% of the time it can be cured.
And Dr. von Rosenving, can colorectal cancer be prevented?
Yes, so having a healthy diet and being physically active and avoiding excessive alcohol and smoking can reduce one's risk, but even more important is making sure that veterans and others get routine screening for colorectal cancer and colorectal polyps. Removing colorectal polyps is the best way to prevent colorectal cancer because colorectal polyps are often precancerous, meaning they have a chance of turning into cancer over time. And there are a number of screening options that are available for veterans and others. We recommend that all Americans aged 50 to 75 get regular screening, and those who have a family history of colon cancer should often begin even sooner. Screening options include colonoscopy, which we already discussed, a similar test called a sigmoidoscopy, which only looks at the lower portion of the colon, a virtual colonoscopy, which is an X-ray test to evaluate the colon, and a test for microscopic blood, such as a stool card. It's important to point out that if you do a non-colonoscopy screening test and it's abnormal, that you need to follow that up with a colonoscopy. And it's important to point out that not for each individual, there isn't one perfect test, and you really need to talk with your doctor and to figure out what test is best for you because each test has different risks. And different veterans and different other people might have their own preferences in terms of what they would want. So the key is just to get some type of screening seems to be the most important.
And if a veteran is unfortunately diagnosed with colon cancer, what are some of the treatment options available?
Yeah. So most colorectal cancers need to have surgery to remove the affected area of the colon. In very early colorectal cancers, sometimes they can be removed during a colonoscopy. More advanced colorectal cancers, especially ones that have spread to other parts of the body, are treated with chemotherapy, and rectal cancers are sometimes treated with radiation therapy as well.
And Dr. von Rosenving, I understand that you are conducting a study at the Baltimore VA Medical Center regarding colorectal cancer. Can you tell us a little more about the study and who's eligible to participate?
Sure. The study is called CONFIRM, and it's being conducted at 42 VAs around the country. And the study is looking to assess 2 different types of screening strategies for colorectal cancer to see which one is best at preventing death from colorectal cancer. The 2 strategies include colonoscopy and a test for microscopic blood in the stool called a fecal immunochemical test, or FIT test, which is a newer and we believe a better test than the old-fashioned stool cards. Veterans who are aged 50 to 75, who are at average risk for colorectal cancer and are due for screening are eligible to participate. So far, we've enrolled over 100 veterans in Maryland and over 8,000 nationally, but we're looking to enroll about 1,000 in Maryland and 50,000 nationally, so we still have a ways to go. If a veteran was interested in the study or wanted to participate, they can be referred to the study by their primary doctor, or they could call the gastroenterology office at 410-605-7299 and ask for information about this study or other studies that we have ongoing.
Outstanding. Thank you for that.
And doctor, I want to go back to the symptoms. If someone is experiencing some of the symptoms that you mentioned, what should he or she do?
Yeah. Well, the first thing they should do is talk to their primary doctor. Their primary doctor can assess the symptoms, can refer them to the gastroenterology clinic if appropriate, and they can also look for other conditions that might be causing their symptoms.
And Dr. von Rosenving, for our viewing audience today, where can they go to get more information about colorectal cancer?
Yep. So there's 2 good websites that I can recommend. The Centers for Disease Control, or CDC's website, which is www.cdc.gov, and the American Cancer Society's website, which is www.cancer.org, are both excellent resources that have a lot of information on colorectal cancer. And once you go to their main page, a quick search for colorectal cancer will bring you to the pertinent pages.
And Dr. von Rosenving, we're going to be going to a break in just a few seconds, but if there's anything you can leave our viewing audience with about colorectal cancer, what would that be?
Well, the thing I'd like to emphasize the most is that veterans get screening for colorectal cancer. It's very important. We have about 40 veterans per year at the VA in Baltimore who are diagnosed with colorectal cancer each year, and I believe we could prevent a lot of those through effective screening. So I'd like to encourage my fellow veterans to come out and get screened for colorectal cancer.
Dr. von Rosenving, thank you so much for joining us today. I really think the information has been wonderfully valuable for our viewing audience, especially Maryland's veterans, so thank you.
Well, thank you for having me.
We're going to go to a short break, but when we return, we'll be talking about the support services available for veterans diagnosed with cancer throughout the VA Maryland healthcare system. So stay tuned.
The best thing about long-term care is that we look at our residents, we don't call them patients, they're residents. They don't live in our facility, we work in their home. So the environment, it's a home-like environment. We look at them for what makes them special. What are their preferences? What are their uniqueness?
I am very happy and secure to know that he's somewhere where he's being cared for. I know that he's safe. They're never just sitting idle. They do have trips. They understand different things about them and they'll explain it to us.
Other than a community living center, we provide rehabilitation services and post-acute services. So not everybody is a nursing home resident, so they may be called patients. We all work together to make sure that we plan and provide the compassionate, safe environment for our veterans.
Welcome back to Veterans Health Watch. Joining us now to talk about how the VA Maryland healthcare systems helps veterans with cancer manage their day-to-day lives are Christine Hess, an oncology social worker, and Rebecca Adams, a cancer care coordinator for the VA Maryland Healthcare System. Ladies, thank you both for joining us today.
You're welcome.
Christine, why don't we start with you and have you describe your role as a social worker in oncology with the VA Maryland Healthcare System?
My role is to assist patients and their family members and caregivers in dealing with their diagnosis, helping them find resources, navigating the system, so to speak. It can be very complex sometimes. And also at the same time working with the oncology team and also helping some of the providers to understand how certain things can be accomplished within the VA if they're not used to using some of the services.
And Christine, we've been discussing veterans with colorectal cancer or breast cancer, and I know if you are diagnosed with one of these cancers, it can be overwhelming for a veteran or their family members. How does your role help alleviate some of that fear or anxiety for a veteran?
The first step is going to be to assess, when I meet a patient and I meet the family, what are the stress factors? What is their emotional state? For some veterans, the diagnosis itself, they may resign themselves to, I'm going to beat this, I'm going to get treatment. But the stress factors may be related to how am I going to make it while I'm undergoing treatment. So I have a variety of things I try and refer people to based on what I see they might need and what they would like to do. So if it's emotional things or just learning more about the cancer, I can refer them to either go to the American Cancer Society, also online. We have a lot more veterans and families now who do online research. So I may deal with the American Cancer Society. I may give them, we have written material. I will also coordinate with the nurses who administer the chemotherapy, with the providers to let them know what questions they may need to address again and answer more so the patient and the family can sort of breathe a little easier. I may also refer some patients and families to the Hopewell Cancer Center support. It's on Falls Road in Lutherville, which is free to anybody. They can do online. They can also go there in person for a variety of services. So those are kind of some things depending on what the patient wants to do as far as accessing community services. What I also deal with a lot is how am I going to manage? Maybe somebody is already on retirement and is financially secure, but they may need help with transportation cost. So I have a resource, I will try and refer them. They may not have anybody to provide transportation. So I work with the DAV transportation service at our VA. They're wonderful in trying to accommodate the best they can and help out with our patients. Do I need to assist them in applying for disability benefits, depending on what, not only the cancer diagnosis, but if they have other medical issues that also compact the whole diagnosis, to help them file for Social Security. I know about VA benefits, so I can assess also should they apply for something, and then I can refer them to a veteran service officer to assist them with the whole filing process and be like a go-between if they choose to file this. And as people progress through treatment, we have patients who do very well. They come back then for set intervals for visits, and sometimes I meet with them to get an update. And sometimes we have patients also who have either their cancer gets worse or the other medical conditions get worse. And so then I will work with the providers and the patient and the family and finding resources. Do they need some home care to maybe alleviate some getting stronger again? Do they need comfort care? Do they need hospice care? And then that's kind of what I work with there too, and to educate also providers in what resources we have.
And Rebecca, in your role as an oncology nurse navigator, what exactly do you do to assist a veteran who's diagnosed with cancer?
So we can do a lot of things. I look at the navigator as a patient guide through the healthcare system. Healthcare system is pretty complex, and often patients need multiple tests and procedures before they can even get to their treatment. So the navigator can help them along the way, coordinate those things, eliminate any gaps along the way, and help them with the treatment process. We can also communicate to the rest of the team what needs to be communicated so that they're aware of where the patient is during their treatment process. And we can assess their physical and psychosocial needs and anticipate any potential barriers to the treatment they might have.
Rebecca, I understand that the VA Maryland Healthcare System has established a new Nurse Navigator program. How did this program come about?
As part of the commitment to the patient-centered care, we want the veterans to be more involved with their treatment decisions. The nurse navigators can help coordinate these treatment plans so the veterans are aware of where they are in the steps along the way. So they can be better educated and we can eliminate any gaps or delays.
Sounds good. So Rebecca, does the oncology nurse navigator then become the single point of contact for a veteran once they're diagnosed with cancer?
They can be one of the point of contacts for the patient. Often they have several different treatment teams involved by the time they get diagnosed with cancer, so it's pretty confusing to know who to call for what. By having the navigator, we can at least lead them in the right direction if they're not sure, or provide them with the resources that they need.
And Christine and Rebecca, how do veterans get referred to you for services?
In my situation, it's through direct referrals through a provider. My office is right there in the clinic, so patients can be encouraged to contact me at any time. My name is also on a handout, and the providers also know to send patients to me or through a consult, but usually it's through word of mouth, and I will be available, and I will make sure they have my contact information then.
And how about for you, Rebecca?
For me, it's the same. It's word of mouth. The physicians can refer them to me, or I can contact the patients after they've been diagnosed to talk to them and assess them for any needs they may have.
Rebecca, Christine, thank you so much for joining us today. I really think this was wonderful information for our viewing audience, especially for veterans who are living with cancer and learning about the wonderful support services that you offer for them. It's outstanding.
Okay, you're welcome.
That wraps up another edition of Veterans Health Watch. If you have questions about today's show or you'd like to make suggestions for future topics, please contact us at 1-800-463-6295, extension 7101. You can also visit us online at www.maryland.va.gov. We'd also like to see you on Facebook and on Twitter.
And remember, if you are a veteran or you know a veteran who is not enrolled in the VA Maryland Healthcare System, please call us at 1-800-463-6295, extension 7324. Visit one of our medical centers or visit us online. We'd love to serve you. Please join us again next time.
I did not know where to turn, and I called the hotline, and they really helped me. I was in a very dark place.
My family called for me. I did not realize that I needed help, but I'm glad they called. I'm doing so much better now. I'm working again.
The hotline staff was very supportive, and it connected me to a program at my local VA.
The suicide prevention team helps me when I need refills of my medication or need an appointment quickly with my doctor.
I thought that I would feel uncomfortable talking about my PTSD with a therapist, but it has helped me live a better life.
The suicide prevention team sends cards to me each month to check on me. That makes me feel special.
I was depressed and had relapsed, and the VA provided me with good mental health and drug treatment. I have now been clean and sober for 18 months.
It does take courage to ask for help, but once you do, you will get the help and support you need to feel better. It worked for me.